welcome everyone to another episode of the Behind the Counter Show. Today we have a special episode. We'll be discussing pets specifically in compounding pharmacy for those of you watching on Facebook and Instagram. And for those of you watching after the fact, you'll be able to see it. If you're listening after the fact, you're not going to be able to see exactly what's going on, but I can assure you we'll have some fun. Our guest of honor is sitting here on the side, panting heavily, waiting to join
I'm not the guest of honor.
No, I guess it's not you. You're not the one panting heavily, I hope. But...
No, I'm not panting heavily.
Anyway, so today we are discussing compounding pharmacy, specifically as it relates to pets. So John, who's a compounding pharmacist, is going to discuss quickly what exactly is compounding pharmacy in particular. And if you have any questions as we go, feel free to shout it out. We are trying to figure out what exactly is going on Instagram here. Oh, and here is Axel. Hello,
That's the guest of honor.
How you doing?
So compounding, Vince, is
click that button. Yeah, you're there, and we'll. Nope, there you go. The live button. There you go.
All right. Working through our technical difficulties here, so that's all good.
Hi, Axel.
So compounding is custom making a specific prescription, working with the doctor and the patient. In this case, sometimes a pet. To solve a particular problem or a particular challenge, to make sure that that pet can get its the necessary med and overcome any challenges that may be there with pets. Sometimes getting them to take the medicine is a bigger problem. So, but it's custom making it, working directly with the doctor or the veterinarian, whatever the prescriber, to tailor a solution to help see some therapeutic outcome.
Okay, so custom medication for pets, that sounds awesome.
Right.
We'll get into some specific details about what exactly that means and how we help, but just real quick, obviously we got Axel here, so I'm assuming we help dogs, right? Do we help other pets besides cats and dogs?
Well,
or whatever it rains beyond?
Yeah, absolutely. We help a lot of dogs and cats for sure, this guy. But also, in the past 2 weeks, we helped a poor ball python who had upper respiratory infection.
Really?
We helped a pet rat. And we'll help ferrets. We have several people who have bunnies, rabbits that need medications. In fact, oftentimes there's one patient I'm thinking of. She always brings her rabbits in so we can meet the pets, and we make sure we get their medication to them that they need,
cool.
And we flavor it for them and make sure that it's easy for the owner to make sure they give it to the pet, because if the pet doesn't take it, it doesn't do any good.
Sure,
right?
Totally. Everyone say hi, Axel, by the way. This is John's dog, Axel. He's a good boy. Okay, so cool. So we help all kinds of animals, but what specifically do we do? We talk about medication in general. Do you have any, stories or anything like that of how we help, or anything in particular you can think of?
Sure. So it's about we have a special state of the art lab that's USP 800 compliant, and so we're fully stocked with different kinds of medicine. So like a couple weeks ago on a Friday, a doctor needed a special medicine, penicillamine, for a dog, that we had to make these capsules for a critical issue, and so we were able to make those into capsules. Now it's not extremely difficult to make the capsules, but it's also important to make sure you have all the different medications in stock and readily available to help the patient that day when something urgent comes up.
Gotcha. So what about, Mary Lou asked, what about humans? We also do compound for humans. Today we're focusing more on the pets and how it helps, but we are a compounding pharmacy for people as well. We do hormone replacement therapy and a bunch of other things. So if you have any questions about that too, feel free to give us a call, 201-997-2010. But today, so that's a cool story. It's really cool for an urgent scenario, how we're able to help. And
Yep.
You mentioned something for the snake too.
Right. So
Respiratory
he had an
infection?
upper respiratory infection. A ball python's a pretty large snake, and so of course we always custom flavor everything. So we asked people, the owner, what do they like. Of course, they wanted rodent flavor, so we did not have rodent flavor, but he did in fact also like certain types of fruit. So we were able to flavor it in a fruit flavor for it.
Interesting.
Yeah.
Well, speaking of flavoring, I believe we have some flavoring samples here that we can actually show for those of you watching on video.
So if you're seeing something like this is a syringe, an oral syringe, and it's got obviously be able to measure the exact dose, but something like this that's flavored, Axel, I'm just taking a little bit out, and normally I could just squirt this into his mouth or put it on a small amount of food, and Axel will be happy to take this
I might be happy to take the peanut butter
Right.
flavored one myself.
This is a peanut butter flavored, and he certainly likes that. And he's very happy to have that, and I think he wants some more. But we also have it's not also just limited to flavoring. Flavoring is one aspect of it, but you need to have different devices to administer things. So, for example, we use this a lot. This is an MD syringe. So this gives a very very small volume of the liquid. So sometimes if it's a small pet or let's say a cat, and it's very easy to just squirt out a zero point 0.1 mLs, or there's certain meter doses. So you can just open this, Axel. So you try it.
Axel, what's
Yeah.
that?
So
What's that?
it's just a and so he'll take it right there, and it's just such a small volume of liquid that it's very easy for the owner to administer. And again, when we flavor it, this one happens to be beef, and he seems to like that a lot as well. So it's just not the variety of flavors we use, but the different types of devices that we use to make sure that it's easy to get the pet to take the medication.
And just Mary Lou, to follow up on your comment, yes, we do help for compounding for humans as well. So if you have any other questions about that, just give us a call. But yeah, so for pets too. So obviously flavoring is interesting because if they're not going to take the medication, it won't help, right? So
Sure.
flavoring can help. What else can we do, or what if the flavoring is, beyond just flavoring? What else can we do? And the device, obviously, too.
Well, are you talking about maybe perhaps like alternative things to oral therapy,
Sure. Yeah.
for
Sure.
example? So yeah. So then another great
I think
alternative.
Axel wants more beef.
Yes, he does. I guess want a little bit more.
These
So,
are placebos, by the
yeah,
way. These
yeah.
are not. There's no medication.
He
in
just
here.
wants to take. It just makes it a lot easier when you give the pet a flavor they like. Then they're more willing to take the medicine. But let's say they're not willing to take it. I've had cats as well, and so certain dogs are a little bit more difficult. So there are other devices, such as applying things transdermally. So we can. Oh, there's Brooklyn.
There's the other one.
So
Brooklyn. Shh.
Brooklyn doesn't know we're live, and it's
Zoom
blowing up
here
our thing.
today.
Yeah. So anyway, so this transdermal, this is a microclick syringe. It delivers a very very small amount of medicine, and inside this little gel that's here, it's called a transdermal gel. In zero point 0.1 mLs, which is a very small amount. We'll show you here. I don't know if you can see it, but I'm going to do just 2 clicks, and it's going to give out a very small amount of cream. And then this can be administered, for example, and there's going to be another video on our website with more detail, right to the inner ear. And sometimes the pets don't even know you're administering it. This is, again, placebo cream. Normally, if I were administering medication, I'd either wear a finger cot or a glove to protect myself from getting medication on me. But the pets like their ear rubbed anyways, cats and dogs. So sometimes you could administer a medicine, they don't even know it. And we'll put in medicines like, I've done things like heart medications, water pills, amlodipine, so blood pressure medicine, or pimobendin, for some medicines for heart failure. Even more commonly, we do things like for felines too. We do a lot of thyroid medications like methimazole. Even metronidazole too is for
And
infection.
I noticed too, it's giving you the exact dosage because of that device there, right?
Right, this exact dosage is, and it's a very small concentration. The idea is like, sure, with certain things, with certain other types of creams, if you had to give a large amount of cream to rub in, it would be very difficult, and you'd have to be there for a while. So you want to try to make it as concentrated as possible, so you can just get that in there and rub it into the ear where there's a lot of.
Is there any medicine for Axel to make him not think that he's a lapdog?
Yeah, he does think he's like a Yorkie or something, doesn't he?
Okay, so we talked about dogs a little bit, and we do that for cats and other animals as well. That same
Sure.
kind of
Yeah.
medication?
So we do for cats. We do a lot of transdermal gels. And again, using this kind of a special device helps us to concentrate it into a very small amount, so that it's a reasonable thing to administer. You can't get 2 or 3 grams and try to rub that inside the ear of a cat, or which is much smaller than Axel's ear.
Now, what about the cost of these medications? We did get a question before the video went live that these meds, obviously it's custom, so I mean, pets in general probably not covered by insurance, but is there anything you think there that, or anything to consider on the cost side?
It's a good question to ask because we're local and we're very easy to get to. We also ship and do that as well. But a lot of vets and people too think that sometimes a mail away pharmacy might be a better alternative. And I have to tell you, it comes up often that our price is quite similar. You're saving on shipping because we're local and you can actually pick it up. Then if you're in a pinch and you're running low or the doctor changes the dose, we're right here to help you. If it's a weekend, if it's at nighttime, so there's a lot of value in having a one-on-one relationship with somebody that knows you and knows your pet, as opposed to working with a large mail order concern, which certainly would produce what they're supposed to and do a
Sure.
good job. But I don't know if the service level and the turnaround time is going to meet what we can do. Particularly, I remember one time a vet prescribed an antibiotic and he was going to send it to a mail away place. And they just decided to call us at the last minute, and it was a Friday, so we made it that night. They got the medicine and started that medicine Friday night. They wouldn't have had the medicine from the other place from Arizona till Tuesday.
Yeah, that's crazy.
And it's an
Now,
antibiotic, so
in general, obviously, the cost of the actual medication itself is going to depend on whether it's generic and what we're actually doing in the
yeah.
medication and that kind of stuff.
But we're not, it's not, it's always worth talking to the pharmacist calling us and saying, hey, what does it run for something like
Sure.
this? Because you'd be surprised. We're right there in the ballpark.
There's a lot of unique challenges that pets have too, or we have as the owners of pets and taking care of them. So sometimes yes, some of this medication could be available over the counter, some of it could be available commercially, or they take what's available commercially. But sometimes that's just not an option. That's really where compounding is effective, because if there's otherwise the alternative is not really helping the patient, right, or the dog or cat or whatever.
Right. I mean, sometimes, like with some of the other things that we run into is that the medicine is available. Let's say there's a medicine called a trilostane that the vets often use for Cushing's disease, and that's always in a large dose, like 30 or 60 milligram capsules. But it's all weight based, and so if you have a small dog, a lap dog, not like Axel, but a real lap
real
dog,
lap dog. Yeah.
we can take that 60 milligram capsule, and in our lab we are able to use that active ingredient and carefully through calculations and doing certain statistics with the capsule create like a 4 milligram or an 8 milligram, or if the doctor needs 7 milligrams, whatever it exactly needs to be, we can do that. So I think
Sure.
that's another way that we can we are able to help.
Now, to answer Casey's question on Facebook too, yes, we do the same for children, so we can disguise the taste of the medication through flavoring with children as well. So yeah, a lot of these same concepts apply for pets or people, but that's a good question for sure. So what other devices? I see we have some other things on the counter here besides the syringe for the flavor, or the placebo medication. What else do we have down here?
Okay, so I showed you the MD, and I showed you this microclick. This is an interesting device. This is called a dial-a-dose. So often used for to put inside a pet's ear, so you can see the long tip. And so there's a certain numbers that you may be able to see. I can't, but a certain amount of grams that you would put in here, and then there's a concentration. So you can put in. We put in antibiotics, steroids. Sometimes an anesthetic. So if a pet has an inner ear infection and they need to have that applied, this is a really neat solution, because you just apply this once a week, and it's in a special base that's used specifically to apply to the inner ear. And then oftentimes this is done actually at the vet's office. So sometimes we'll supply animal hospitals with these, but sometimes they're used at home as well. And that could be used to administer a once a week kind of anti-infective, anti-inflammatory med.
Interesting.
Yeah, very interesting.
Cool.
Yeah.
Now, last thing here too, and you can provide more detail. I remember there was a patient we had, a puppy, who had some serious skin trouble, and there was some kind of over-the-counter cream we gave, or we made it, but it was over-the-counter or something like that.
Right. So we have a special product called and this is just a little small sample of it. It comes in a larger version of this that we have that's over the counter, and it's called Gaspar's therapeutic pet salve. And obviously, when you're trying to apply a cream to a pet, whether it's a cat or a dog, the fur is very thick and it's difficult to apply these types of things. But this is a special base that's made to apply to a pet's fur. And let's say a dog has a hot spot or something where they can't they're not leaving it alone, and you're just this actually over the counter works well just as a salve to help a hot spot heal. If necessary, we have also done working again with the vet. That's what custom compounding is all about. Working with the owner for the pet and working along with their prescriber. We might add in a topical steroid. We might add in an antibiotic to help that even accelerate the healing process. But that would require a prescription, of course. And this over the counter though is amazing. It's got a great texture to it. And like I said, again, it works well to get through the fur,
right?
So
and it's safe for the pet if the pet were to sometimes
that's an excellent point, right?
Yeah.
It's not a problem if the pet does fuss with it or lick it. It's not
right,
non-toxic.
Because the way you've explained it to me before about that is a pet has some kind of skin issue or a rash, and the problem is they keep nipping at it because it's itchy and it prevents it from healing. So the way this works, it kind of also doesn't allow them to break the seal over whatever the wound is or whatever it is. Right.
So you're trying to create a barrier so that the skin
can,
the skin can almost everything can heal from within. And the texture of this, it seems to dissuade pets. They don't seem to when I've used it generally they don't like it. It's kind of like when they touch whatever it's the texture and a little bit of the taste, they tend to avoid it.
Sure.
But even if they did get some, it takes ingest some, it's not harmful. So no,
so it actually allows them to heal whatever the rash is. We have some really cool before and after photos. Obviously, we can't share those in the live now, but of pets, even with only the over-the-counter version.
Yeah, no, that's not by itself.
It's
the same thing as like if you were to apply, it's the winter time and your hands are get dried and cracked, and you can use an over-the-counter salve to help you heal. Sometimes that's enough. Sometimes you need a prescription, but this is a salve specifically made for pets and pet fur.
Very cool. Are there any other stories here as we wrap up? And if you have any questions, please let us know or reach out. About pet medicine, I think Axel is beyond his contract. We had him for 10 minutes, and he was gone after that. But are there any other questions or comments you want to make about pet compounding in general before we wrap up?
No, I mean, I just would say that sometimes things, it's worth checking out and having a conversation with us here because we're very accessible. Our compounding pharmacists, we have 4 great pharmacists here, and we could be on the phone with you in a minute or two to answer a question. And sometimes it could be something like, God, I've been trying to get X and Y medicine. There was something called Vet Medin that was on back order or intermittent availability. So sometimes things like that can be compounded, and then if they want to go back to the other one when it's available, that's fine. But so sometimes we'll be able to help when there's an out of stock situation. When things are on back order, sometimes we can help by, so that's one story that's happened.
Sure, kind of like, human example, but during the heat of the pandemic, we were doing that with Tylenol in our compounding lab. You couldn't get Tylenol anywhere, and we were making it. So that's another benefit to compounding too. In pets or humans, if something's on back order, we can still make it and get it.
Exactly, yeah.
Actually, you want to say bye, buddy? Come here, buddy. You want to say bye? Come here. Come say bye.
Come on.
All right. If there are no other questions, then we will wrap up for the day. Axel, say, Brooklyn's here too. Come here, Brooklyn. Can you get up here?
Yeah, you've got a full house.
All right. Don't take my hand off. Thank you. Well, if anyone else has any questions, feel free to chime in after the fact. You can learn more about compounding or talk to John or other pharmacists. Just visit our website at hbpharmacy.com or call us at 201-997-2010, and we'd be happy to chat to see if pet compounding or compounding in general is something that can help you, your pets, and anyone else in your family.
All right. Yeah. Thank you so much.
Have a good day. Thanks.
Look forward to your questions. Thanks.